Okay, thank you. Good morning, afternoon, evening, everyone. Thank you so much uh, for this opportunity. And thank you for joining this session. As Cha has introduced me, my name is Chelsea Kariuki, and I'm a technical project manager working with IntelliSoft Consulting Limited. Today, I'll be sharing with you about Mama's Hub, which is a maternal health information system that we developed through the Kabarak University project in partnership with IntelliSoft Consulting Limited. And our focus is on how we digitized the mother and child health booklet and how that digitization is transforming maternal health care in underserved counties in Kenya. So I'll first start by introducing our organization. You can see my slides are not, okay, perfect. So IntelliSoft Consulting Limited is a Kenyan company with over 15 years of experience in designing, developing, implementing, supporting and maintaining digital solutions for particularly LMICs. And our primary focus as embodied in our mission is health IT systems for Africa. And we work towards strengthening health systems across research, clinical and primary healthcare settings, as well as surveillance through the required health management information systems. So our current and past projects are spread across Africa, covering quite a number of countries such as Kenya, Uganda, Tanzania, Ethiopia, Nigeria, just to mention but a few. So I'll begin with the problem that we were trying to solve. Maternal health remains a critical concern in Kenya, despite the progress that has been made over the years. So we've had expectant mothers who are, unlike most other patients, being responsible for carrying their paper records during each antenatal visit. So these records often get lost, some are incomplete or even forgotten, which then disrupts the continuity of care and delays the urgent interventions when emergencies arise. So Mama's Hub addresses this challenge by providing a suite of applications for real-time data capture, storage and sharing of this data across the health facilities. So at least this ensures that the mothers are able to receive timely and safe and seamless care throughout their pregnancy, while also giving the providers the information that they need to be able to make better decisions as they are providing care to the expectant mothers. So the main objective of this project was to digitize the Kenya's mother-child health handbook into a a fully functional maternal health information system. And specifically, Mama's Hub seeks to collect the data, store, analyze, and disseminate the maternal health data in underserved populations, thereby supporting the delivery of the antenatal care to ensure positive experience for the mothers, as well as providing a sustainable system that can integrate with national platforms such as our Kenya Health Information System. So this not only ensures that better care is provided at the patient level, but also valuable insights are provided that support the policy makers. So we had different target populations, first and foremost being the pregnant mothers in the underserved areas. So for the expectant mothers, we wanted for them to have improved ANC services, reduce preventable maternal and child deaths, as well as just offer an overall better pregnancy experience. And for the health system, including the healthcare workers and the policymakers, we wanted to have them supported to provide better care to the expectant mothers, as well as strengthening universal health coverage in underserved areas and also providing reliable data to them to inform the policy and research, as well as streamlining the reporting to the Ministry of Health. So I'll give you a quick look at how Mama's Hub was developed. It was built on the Open Health Stack, and it aims to provide a standards-based approach to developing healthcare interventions that align now with the global standards, such as the WHO SMART guidelines, as well as the HL7 FIRE standards. The development of the application, as I've mentioned, was guided by the WHO standards, WHO guidelines, as well, WHO SMART guidelines, as well as the principles for digital development to ensure better success in its design, development, deployment, use, support, and maintenance, so that the system was able to be developed in a sustainable manner. So I'll walk you through the 5 layers that the SMART guidelines have provided and the steps that we took as we're developing the solution. So we referred to the national guidelines for quality obstetrics and perinatal care, as well as the mother-child handbook. Then through different workshops and interactions with the different stakeholders, we were able to author the digital adaptation kit for the maternal health information system by leveraging, the WHO Global DAC for ANC. From there, we were able to author our FIRE IGs and develop our reference software, which is Mama's Hub. And from there, we are yet to implement the precision health model. So the scope of Mama's Hub ideally includes both the patient-facing and provider-facing components. For the mothers, we had a mobile application that serves as a personal health record with reminders, appointment tracking, and also access to their ANC history. And for the providers, we had both the mobile and web applications that will support the registration of these patients, the management of the ANC records, and also support in clinical decision-making, as well as generating, the national ANC reports that need to be shared with the Ministry of Health. Importantly, we were able to integrate with our national reporting system, KHIS, which allowed for automated indicator reporting. So as I've mentioned, the system has 3 components: the mobile application for mothers, which is patient-facing, another mobile application for the nurses, the clinical officers, and community health volunteers, and the final one being the web administrative portal, which was used for user management, reporting, and facility oversight. So these are just screenshots that I've taken from the application for your reference. So together, these 3 platforms make ANC more efficient, standardized, and data-driven. As I mentioned, Mama's Hub was built on Open Health Stack, and it uses an offline-fast, FIRE-ready Android application that utilizes our FIRE SDK library, which is a platform that the development has actually been actualized by key stakeholders in the digital health space, that is Google. So once data has been captured on the forms, it is synchronized on the Happy FIRE server, which serves as the data repository, and the data capture forms are defined using FIRE questionnaires. Decision support rules, including alerts and reminders, are also built into the platform. And then for the web application, we utilized it for user management to create and edit the provider user accounts, facility management to add new facilities that adopt the use of Mama's Hub, performing data capture on the forms, and then generating and exporting the reports. So through the FIRE analytics, we've been able to integrate the data warehouse with Superset, provide near real-time dashboards and visualizations, as well as just generating the reports that have been required. And then we've been able to manage client access to these resources for the provider and client-facing applications. integrating with KeyCloak for identity and access management. So using the Fire 100 SDK and the Happy Fire server, we are also able to support offline data capture and synchronization when internet connectivity is available. I'm glad to report that there have been several milestones that have been achieved. The Mamas Hub mobile application was launched in Play Store, allowing the mothers to log in, view the ANC records, see appointments, and also receive reminders. And the provider-facing application was delivered, supporting the patient registration, ANC record management, and decision support. Community health workers are also able to make referrals through the system and follow up with the patients digitally. And the system also generates reports that are required by the Ministry of Health, which is now the MOH45 and the MOH711, which now eases the burden of reporting for the different healthcare workers and the health facilities. We were able to do a pilot in 3 facilities in Nakuru. And through the pilot, we received a number of feedback from the end users, which we were able to incorporate before we did our training of the system and a deployment of the system successfully. And we were able to share the user manuals and training materials for the different roles or other users of the system to support them even as you onboard new people or need a refresher training for the different users who will be interacting with the system. And for the IT or other technical teams, we were able to share with them the technical documentation as well as the QA reports to allow them to be able to maintain the system after we handed over the system to them. From my experience so far, we had a few key lessons standing out. So first and foremost, it is important to engage the end users. In this project, specifically the nurses and the mothers, early in the process, I ensured high adoption of the system and also solving of the user pain points. Building on standards like FHIR has future-proofed the system and made it interoperable, ready with the national systems that are being used in the country. And through the strong partnerships that we've had between the different academia, the implementers and the government have also been vital to our success in this project. So before I wind up, I'd also like to appreciate our partners. We had the National Research Fund of Kenya, who were our primary sponsors, Kabarak University, who was our lead implementation partner. We had Strathmore University and the Technical University of Mombasa as academic partners, and us as the Intellisoft Consulting Limited, we were the development partners. So in summary, just so as to not take quite a number of minutes, Mama's Hub has been more than a digital application. I believe it's a step towards transforming maternal healthcare in Kenya, strengthening the ANC services being provided, and also informing policy with real-time data. That will be all for me. Thank you for your time.
Thank you for introducing Mama's Hub to the AN community, Ms. Chelsea. Apologies, Dr. Alvin has been called to an emergency meeting, so he might not be able to manage the Q&A, but he also left some questions here in the chat. So maybe to start, our first question is Mama's Hub connected to Kenya's client registry, facility registry, and worker registry?
At this point, I'd like to introduce my colleague Amolo, Brian, to take over the questions.
Thanks, Chelsea. I hope I'm audible. So for the first question, is Mama's Hub connected to Kenya's client registry, facility registry, and health worker registry? So at the time the project was beginning, a lot of these components or the roadmap for the Kenya National Superhighway wasn't yet developed. So at the moment, a lot of these registries are maturing. So That's an enhancement that you can think around, but at the moment it's not connected.
Thank you, Sir Brian. There's a follow-up question regarding that from Dr. Thomas. So, is there a central repository for national integration, or is this repository a use case based just for maternal health?
All right. Thanks, Thomas. The project, the use case was around maternal health. So a lot of the data in the repository is just for maternal health.
Yes, thank you, Sir Brian. We also have another question here from Dr. Alvin. So, how long did it take to develop Mama's Hub from kickoff to go live?
All right. So in terms of the timelines, we took a span of around a year, so between 8 months and 1 year, which for such a project was quite a short time. But given the choice of tools we had made, but from inception to the time of pilot was close to 1 year.
In relation to that, how long do you think will it take for a site to start using Mama's Hub from kickoff to go live?
So just thanks for the question. So just a bit of background. Mama's Hub is built around the maternal or the ANC smart guidelines, which means that all you need to work from is from the guidelines point of view. And so long as you can be able to come up with correct guidelines for Asia, then we can easily tweak it to match that use case. So I can't say conclusively on the time, but should be around a similar time. Maybe I can let Chelsea comment on that.
I agree with you, Brian. Just as you've mentioned, and as I had indicated on the slide deck, we did leverage the WHO SMART guidelines for ANC, of which the WHO has already provided recommendations and guidances that countries should follow around ANC. And I believe the policy documents that have been developed by your ministries of health in the different countries leverage the guidances that have been provided. So ideally for for the teams that will be doing the development process from requirements gathering, it's just referring to the policy documents that have been provided, being able to interact with the users and find out their pain points before you can now get to designing and developing the system. So considering it was the same process that we followed in our context, the same timeline that Brian has provided would suffice.
Yes,
Thanks,
thank you, Sir
Chelsea.
Brian and Miss Chelsea. We have another question here. What were the enablers to Mama's Hub and what were the distractors?
All right, I can comment from a technical point, and then maybe Chelsea can talk from the project perspective. But for us, our biggest enabler, I think, was the willingness and the vision that the county had at the time of transforming maternal health care within the county. So that was the biggest enabler, because through that, we were able to get, I think, funding, and then just the support from the county. That includes having healthcare workers work with us, having to get time to interact with some of these community health workers, uh, uh, getting the partners together. I'm sure some of you know from this project, sometimes it's not very easy to move forward, but there was a lot of drive from the county. So that was the biggest enabler. But the other one was also the leadership in the project. So from IntelliSoft and also from the other partners. So they were actively collaborating and coming up with strategies to help us at any point that we had blockers, given that it was also something quite novel. Some of the biggest distractors, of course, will be the landscape. So sometimes piloting some of these things in the ground is not as easy. So the issues like connection, unexpected downtime, but all in all, I'd say the positives will generally outweigh the negatives.
Okay, Brian, just to add on to what you said from the the project management point of view, although I feel like you've captured on them. We really appreciated the strong partnerships and collaborations between the Ministry of Health, our funders, as well as our implementation partners. The early engagement of the end users as well helped build ownership and adoption of the platform. I think the other thing I can mention is the use of global standards in our development and our technology choices. So adopting the use of the SMART guidelines, specifically for ANC from WHO. Also the use of HL7 FIRE as a standard and building our platform using the open health stack, ensure that our system is easily interoperable ready, aligns with the international best practices in developing digital health solutions that actually serve the end users and have them in mind. And it also enabled functionality in low resource settings, I think the other thing I'd say is the system was tailored to the real pain points of the end users, for instance, like the mothers having lost paper records or even forgetting about their appointments, and for the providers struggling to actually provide better care to the mothers without that information, and also their manual reporting burden. So I'd say that those are some of the enablers. For the distractors, I believe, Brian, you've been able to capture that when it comes to infrastructure challenges, as you're piloting solutions in areas that are underserved. So I'd say that was probably the main distractor. Thank you.
Yes, thank you, Sir Brian and Miss Chelsea. Another question here is the local storage and the mobile device a file or embedded TBMs such as SQLite?
Thanks for the question. So as Chelsea has shared, the application is based around the open health stack. So just a bit of background on one of the components, which we heavily use is the Android Fire SDK. So this is what is actually in charge of managing a lot of the data on the phone. And in the background, it uses a SQLite database. So all the data is persisted within the SQLite database and it's encrypted to prevent other parties from accessing it or other applications from accessing it. Yeah. So the underlying database is a SQLite database, but the users don't really interact with the database directly. There is a Fire engine that provides like a Fire API, an on-device Fire API. That's very cool. You should check it out. That enables you to interact with the data store now.
Thank you, Sir Brian. We have a question from Dr. John. So does Mama's Hub work with basic phones or one must have a smartphone? USSD version?
All right, thank you, John. So the phone, it has to work on an Android phone. So that means it needs to be a smartphone. There is still not a USSD version. There is possibility to have a USSD version, but at the moment, the Android Fire SDK purely relies on an Android platform to run on. So that is most definitely an Android smartphone.
Thank you, Sir Brian. Our next question is, did the implementers consider attaching compensations or incentives for submitting data using Mama's Hub for delivering value?
I'll let Chelsea take this.
Sorry, I seem to have missed the question. Could you kindly repeat?
Yes, did the implementers consider attaching compensations or incentives for submitting data using Mama's Hub to incentivize the workers?
Okay. So in terms of the field tests and the pilots, we normally have funders assisting in terms of providing incentives. So this could be in the form of giving the end users probably something like a per diem to come for the training. And also during the early use of the system, providing mobile data to the health workers as they're using the platform in case they need internet connectivity so that they can be able to sync the information. The support is provided.
Thank you, Miss Chelsea. Our next question is from Dr. Aminul Islam. So his first question is, did you create a fire resource profile for Mama's Hub? To what extent was it challenging for you in adopting WHO smart guidelines from L1 to L5?
All right, thanks for the question. Yeah, so yeah, we did create an implementation guide around the ANC DAC. So the foundation was the ANC DAC. So from there, we were able to do the fire profiling work, to have all the profiles for that use case. At the time, I'd say the biggest challenge was for us at the time was the learning curve. As you're aware, smart guidelines is still a new thing, fire is still new. So the fact that it was still a novel thing and the lack of proper tooling to in authoring some of these things and testing them was one of the biggest challenges I remember we had at some point. Then another one will be just getting people to actually understand that this is a very critical stage before application development begins. Yeah, so I'd say those are the major challenges.
Thank you, Sir Brian. Our other questions from Dr. Aminul reads, does Mama's Hub provide any clinical decision support for low resource settings environment, like frontline health workers, as you mentioned, underserved?
All right, thanks again. Yeah, so the application had, I don't want to say limited, but a form of decision support. So majorly during data collection. So the goal was given that the application is going to be used by frontline healthcare workers. Sometimes knowing some things like, say, a mother's blood pressure is too high, or her BMI is not okay, or some other factors, it will be hard for them to make any sense of this data. So we enhanced some form of on-device clinical position support. So as you collect this data, you will get some of these flags, some just to guide you on collecting data, some will help you in making decisions, some will be a feedback back to the user. Yeah, so we did apply some form of clinical position support, but not very advanced given the limitation of on-device data processing.
Thank you, Sir Brian. We also have new questions from Dr. Thomas. So, were there limitations with the use of Android Open Health Stack SDK, like granular UI management or cross-platform accessibility? What is the current landscape of mobile use of healthcare workers in the region? More Android than iOS?
All right, thanks again, Thomas. So as I shared, there are quite a number of challenges with working with data on device. So some of the limitations we had with the SDK is, so first of all, is limited processing. There's only so much data you can fit in a mobile phone and try to report on it or get any insights from this. However, additionally, the SDK was relatively new. So Google had just released the SDK. And so a lot of the things like UI components weren't very well done. As you have mentioned, managing the UI state also wasn't too very well done. And then a lot of the libraries to enable automated workflows wasn't really done. So some of those are quite, those are the most alarming, I'd say, limitations we had. But then having a chance to work with the Google team, we were able to highlight some of these issues. And as you can see, currently the SDK is always under it's under development, and they're constantly making improvements. So there do exist some of the limitations as of now, but most of them that we had at the moment, I believe have. Yeah. So at the moment, I'd say some of the limitations with the SDK will be a lot to do with the syncing and the offline capabilities, especially when you have a very large data set in your Fire server. The SDK tries to fit all this data on device. So this happens to be the biggest limitation. The others you can circle around. But having spoken to the Google team, this is one of the things they have as their priority items this year. Then the second question is what is the current landscape of mobile use of healthcare workers in the region? I can speak for Kenya. Currently, the community health information system, so not entirely related to Farmers Hub, it's a community health, so it's called the Community Health Toolkit, developed by Vedic. But then it's a mobile tool, offline first, and it works on Android, on Android devices. So there's a large rollout of Android devices across the country to support these interventions. So you'd most likely get, for every 10 Android devices is when you get one. But not backed by any stats, but yeah, the Android devices are definitely more.
Thank you, Sir Brian. We also have another question from Dr. Thomas. Is there a PWA web app for Mama's Hub counterpart for non-Android users, such as web and iOS?
All right, thanks, Thomas. So for non-Android users, we did develop a web application. So it was a mobile responsive mobile application. So works well both on a PC and a mobile phone. However, the focus was mostly on desktop users, given that in facilities, there's a lot of use of desktops. So that was our rationale at the time. For iOS, there's still no support for iOS or PWAs specifically.
Thank you, Sir Brian. We have more questions in the chat. This one reads, where is the fire data stored on the cloud?
All right, thanks. So given that the project was being managed by the Nakuru County government, the county government was in charge of providing the infrastructure. So I'm not sure of the physical description, but I know they found a collocation server that we were able to utilize. So that is where all the backend or all the data was being stored. So that is where we hosted the fire server, but it was all on infrastructure provisioned by Nakuru County.
Thank you, Sir Brian. We have some questions about implementation guide. So is it possible to view the URL of the ANC Fire implementation guide that was used by Mama's Hub? And then how much coding is needed if in case the ANC Fire IG is changed? Can the Mama's Hub code automatically get updated also along with the new IG?
All right. So just to explain how we utilize some of these fire artifacts on the device. So I think the first one is fire questionnaires. So just to guide the structured data collection, the Android SDK takes use of the SDC library. So the way this library works is you just point it to a questionnaire and it's able to generate, a questionnaire and it's able to generate a form to be able to fill in this questionnaire. So in terms of questionnaire resources, those ones are a bit straightforward. If you change them, they will definitely reflect on the new application in quotes. Some things are built using Kotlin code, given the limitations of the SDK, as I said at the time. But this is not, it's not the majority of the code. Majority of the code that is in Kotlin is just to enhance some functionalities that were not there, that we think is also will be critical in case you are also building a single app. But in terms of the fire artifacts, a change in the fire artifacts will definitely move you quite some distance in terms of implementing a use case. For the IG, I'll check with our IG developer and see if we can follow up and share that after this call.
Thank you, Sir Brian. Our next question is about Open Health Stack. So some developers have encountered difficulty with OH setup, coding, and debugging. Is this usual? And how can they get help with OHS and Mama's Hub?
Maybe I can let Sylvia take this. But before Sylvia takes this, there's a big community. That's why I called Sylvia. Sylvia is works with the OHS community, and she'll be able to guide Sylvia.
Yes, thanks. Maybe could you repeat the question, please?
Yes, Dr. Sylvia, some developers have encountered difficulty with OHS setup, coding, and debugging. So the question is it usual, and how can they get help with OHS and Mama's Hub?
Okay, thanks for the question. As Brian said, I support with community management for Open Health Stack. And if you have any questions, we have a team that supports the different tracks in Open Health Stack. So you could write to me with your request and I will point you in the right direction. So we have a team that supports with the development and engineering. So if you have any challenges, any problem that you would like someone to walk you through, we're happy to assist in any way. So I'll put my email in the chat and you can reach out to me. Thanks.
Yes, thank you, Dr. Sylvia. I'm not seeing other questions in the chat box yet, but there's a question from Dr. Alvin. Is it possible for us to form an Africa-Asia community of practice around Mama's Hub?
I can direct this to Chelsea.
In terms of forming a community of practice, we would be very happy to actually form a community of practice for the Africa-Asia knowledge exchange. I believe it will be very beneficial because we can learn from each other's experiences through the different implementations that we have done. So maybe I can let Shah, probably we can have a discussion on how we can handle this. And probably when we have more information, we can reach out.
Maybe just to add on what Chelsea said, we are more than happy to have the community set up, but it will be bigger than Mama's Hub. So we would want to include multiple components within it. So I think we are happy to have a conversation as Helena and as Ehin as well, and we can figure out how to set this up together. Thanks.
Yes, thank you, Dr. Sylvia. I think we don't have new questions in the chat anymore. But before we close, I'd like to thank on behalf of AHIN, our colleagues from Helena and IntelliSoft. I'd also like to acknowledge Sir Stephen Wanyi, who's also on the call. Sir Stephen, would you like to speak before we close?
Yeah, sure. Thank you. Thank you very much for the opportunity. I'm sorry I wasn't able to. I was driving, but I reached where I was going. But yeah, really great collaboration. I think just to answer your last question, as Chelsea, Sylvia, and Brian have mentioned, we're really happy to deepen and strengthen this collaboration and partnership we have between Helena and EHIN, and also all the members of the two network organizations, in terms of being a member of Helena and many others that are members of EHIN. I think as Sylvia has mentioned, we're heavily invested in Open Health Stack as a community, and so we see all these implementations working to help us build something strong together that we can then spin off to various use cases. So really looking forward to deepening this relationship. And once again, thank you so much for hosting us today.
Yes, thank you so much, Sir Stephen, and safe travels. Once again, thank you, Dr. Sylvia, Miss Chelsea, and Sir Brian for giving us time to share about Mama's Hub and tonight's webinar. Thank you, everyone.
Great.
Thank
Thank
you,
you. Bye.
everyone. Bye.
Thank you so much.